Are you one of the doctors desperately seeking for your first job and need a reference? Do local references help make your application strong? What about overseas references? How can you ensure the best outcome for getting your first job? Hello and welcome. My name is Dr. Rizwan Qureshi and I'm one of the consultants working here in emergency medicine in Sydney, Australia. And today I'm going to be talking about references. I'm going to break this conversation down into following topics. So number one, what are references? Who should be your reference? What are the contents of a reference report? What makes a good reference for you? How to improve on your references? Yes, that's right. Improving meaning getting some new person to do a reference based on your updated skills, qualifications and credentials. And finally, some do's and don'ts of a reference. Number one, what are references? I remember when I was working as a house officer and was going overseas after doing my PLAB 1 exam, I asked all my consultants to do reference letters for me. And they were mostly professors working in Civil Hospital Karachi, and ironically, they said to me, "Beta, why don't you write a reference letter and I will sign it?" Of course, I was ecstatic. I was very happy, but little did I realize that they are not worth the paper that they are printed on. References are very personal words of your supervising medical senior personnel or medical consultant, and they're offering an additional layer of security before being offered a job. Now, medical application and CV could be 50%, interview might be another 50%, but the references are an independent entity, and sometimes despite having excellent application and interview, you would still not be able to get a job if your reference is not good. Now, here in Australia and some other Western countries, and even now in Pakistan, references are now collected in a form of a standard report, which is done online, and your consultants are basically using a template form answering a very specific inquiry, which is based on your personal and professional organization, teamwork, communication skills, based on their interaction with you at their work. So these are very specific reports. Who should be your reference? Ideal person is the person that you've worked with, who is a doctor and knows you in a clinical capacity for at least 3 months, who can comment on your professionalism. What about an acceptable reference? A person who has observed you in a professional capacity through long courses or education, or supervised you during a research or an educational activity. They can often still fill most of the required criteria of your communication skills, professionalism, and your motivation, but not your clinical skills. So they can act as a good secondary reference. Person who has not observed you or seen you or know you personally or professionally, and your interaction with them through learning education is less than 4 weeks, don't use this reference. When they'll be filling in the reference report, it will be left mostly blank. Anyone like a supervising consultant, clinical tutor, nursing unit manager, even a senior registrar who is at least post-fellowship, they can act as your reference. I would suggest not to use residents and intern as your reference, especially if you're applying for a junior medical officer or a resident level job. What about the contents of the references? Firstly, your name, supervisor's name, your professional relationship with your supervisor, like supervising consultant, clinical tutor, or a personal reference in a personal capacity, that needs to be clearly defined. Next up is your duration of knowing that person. 3 months, 6 months, 12 weeks, 8 weeks, 4 weeks. I think minimum 4 weeks is an acceptable standard. Secondly, there are a specific question in 5 key areas, which basically ask the consultant to grade the applicant as excellent, good, satisfactory, average, below average, and not applicable. Number 1, professional ability. That is based on the clinical knowledge of the candidate, clinical procedural skills, and their clinical judgment. Interpersonal and communication skills, like professionalism in relation to communication, both with medical staff and team members, and also the patient and their relative. So you can see how closely a supervising consultant need to observe the junior medical officer to do a good reference. Number 3, capacity. Your patient assessment skills like history taking, examination, management, and ability to take initiative and responsibility for your patients, and also your keenness to seek supervision and consultation from your senior colleague when you are faced with a troubled or a complex case. Next up is your motivation. This section is about your reliability, your punctuality, and your work ethics, and also your documentation skills, which invariably are an important part of the patient management. Number 5, legal issues. Any medical complaint or any restrictions on their registration that you're aware of. Now, there are also some other very specific questions about candidates' ability to take up a new job. For example, there might be a question from a consultant: do you consider the candidate's level of knowledge and skills is suitable for the level of knowledge and skills required at the job that they've applied for? What is the nature of practice and patient population that your candidate was working in? Was it a private clinic? Was it a public hospital? Does it compare to the level of clinical setup that the candidate's applying for? I've seen some recent reports coming on that would you hire this person again? And if so, why? And if not, why not? Lastly, there's an open comment box, and it is basically a free text information on candidate skills and credentials that are not covered anywhere else through this questionnaire, like their participation in research projects during the term, their ability to help during the time of crisis, like for example roster crisis, sick crisis, their ability to cope with stress, and showing leadership qualities. Now, these are very pertinent and very important skills, and this is separating a wheat from the chaff. These few traits and qualities for a reference take a reference from an average to excellent level. What makes a good reference for you? Well, any reference who can comment on all the above traits that I've just explained, at least at average or an excellent in 3 out of 5 traits. There should not be any below average marks for any reference report. This is an automatic fail. The reference who maintain their own job in a teaching hospital or a tertiary level setting or a good recognized primary healthcare setup, they are good references because they are working in an environment which nurtures growth and professionalism. So those references must be included in 1 out of 3 references that you collect for your CV or an application. If your reference is from a private setting, then please ensure that your job still covers the same content of professionalism, communication, your motivation. When you're working with any reference, make sure that your experience offers them a range of observation of clinical roles. For example, in a ward setting, during ward rounds, clinics, outpatient departments, operation theatre, courses, conferences, presentation and grand round. Now, the reference that are quick in their responses, obviously they are favorable for you because the medical staffing don't have to chase them. Now, how about to get a new reference? People grow professionally and personally, and if you compare yourself with 2 years or even 1 year from before where you are now, you may realize that you have achieved so much. You've passed the exam, you've done more courses, you've even done some more jobs that will have a huge implication for your future job prospects, especially the one that you're currently applying for. And that 2-year-old reference may not be enough. Firstly, whilst choosing a reference, make sure that you know them well and they know you too. Your interaction needs to be at least over a month. This can still be in a form of an online interaction, courses, or some other private administrative work. Reference needs to be earned. This is especially true when people ask me for my reference after attending my online course, and I have trouble remembering them, like who they are and where they're coming from, because most of the time during the interaction they had the audio off, worse enough they had their camera off. And talking to some of my colleagues in indemnity, these references are best avoided because they may have medical legal implications. Also, when references agrees, please send them your emails, updated CV, and the job description that you've just applied for before you apply for a job. An updated photo, they may not remember you out of hundreds of doctors that they've been interacting with in the last few months. Do's and don'ts of your references. Always get your professional references to use professional emails with telephone contact details that are up to date. Best references are based on the work emails. But at the end of the day, the emails which count are the emails which are accurately and quickly responded. Now, always use your current employer as reference number 1. Even if it's a non-medical job, use your current employer as a reference number 1 because they might still be able to comment on your communication skills, interpersonal skills, and team management. Always inform your reference before applying for a job if it's okay to use the reference. Keep in touch with your reference, especially if your references are overseas, and update them every once in a while about, you've done that exam, you've done that course, and this is an updated copy of your CV. Never ever fake a reference by doing it yourself. Most references are online and tracked by computer IP addresses, and they are further clarified by random telephone calls. So all these random checks are to ensure that the reference that is done is 100%. All the references are done under declaration. So if somebody's faked a reference, that declaration is signed falsely and it's a criminal offense. Never use a reference who does not know you well enough and it's an old contact. Just because he or she was nice to you does not mean that they're going to do a good reference for you. Avoid asking for a locum company reference if your consultant is a senior, busy, or academically oriented person. It's just not going to work out. Do not send or ask for references on WhatsApp, Messenger, text, or social media just because you attended a workshop or a conference and you just found them very motivational. Always use an email. Use effective communication skills. In a brief words, what do you want, what job you're applying for, and it would be great if you would have their reference on your CV. Finally, you don't have to influence a consultant to become your reference. If somebody declines or does not respond out of courtesy, they're not happy to be your reference, and it is better to leave them out and pursue someone else. It's not personal, it's all about professionalism. Finally, at the last, I'd like to say, as an IMG, you need not just a good reference, not just above average reference, but an excellent reference. So make sure you give your consultant all the good reasons to be an excellent reference for you. In the end, I'd like to end this conversation with a beautiful poetry from Urdu language. This share in particular is from Mahmoud Saidi. मैं इसके वादे का अब भी यकीन करता हूँ, मैं इसके वादे का अब भी यकीन करता हूँ, हजार बार जिसे आजमा लिया मैंने. With these thoughts, my prayers and well wishes with you. Look after yourself and take a good care of each other. Khuda Hafiz.